we're talking about patients having feelings, whether the complaint is a minor or a major one. They have feelings about being in the osteopathic situation. And an osteopath that is aware of and values the role of feelings in their work will address those feelings mildly and with a view to expanding them. Because ultimately, the feelings actually become stronger and more intense. I'm not putting this very well, but they become stronger and more intense as the osteopathic work continues.
That makes things harder for the osteopath then. In other words, the osteopath may find himself more and more in a hole as the treatment continues, assuming they've treated the patient comes back, I'm not much better, or I am a lot better, or...
Sure, yeah. Okay, stuckness is also a common feature of all professional work. The work progresses for a period, then it gets stuck, and it may remain stuck, or it may become unstuck, and it moves on. And part of the work, in my opinion, should be about recognizing the resistance that patients have towards the work, which results in stuckness, and by saying something about the resistance, you can unhook it. And it doesn't take a lot. It's not a dramatic thing. You can make comments like, it seems to me that you've reached a point where it's difficult to, I can't think of an example. I do have an example. As I said, bereavement is an ongoing physiological process as well as a psychological one. If a patient comes with a pain and you know they've lost a spouse or a parent, it would, in my opinion, be quite reasonable for an osteopath to say, it seems to me your pain may be related to the grief that you're not able to express. Now, that might open the floodgates of tears, but that's therapeutic. There's nothing wrong with that. It's helpful, actually, to help the patient to experience something that perhaps in their normal lives or their outside lives they cannot express.
I can see why an osteopath would be afraid to use that kind of terminology.
Right.
You've got patient coming in half an hour, next on the list. The osteopath knows that the patient will probably cry, or is worried the patient will probably cry. It will take time. Many osteopaths want to just get their hands on.
Yeah.
Now, that might be the fault of osteopathy. That might be something that osteopathy needs to look at.
Yeah.
Or it might be something that osteopathic colleges need to look at. But I can see why that would bring up some fears amongst the practitioner.
Indeed. If you are working to the clock, then this kind of fear about going over time because of the emotions would inhibit that kind of work. And that's why I think one would need to be more flexible.
Mm-hmm. Run over time?
Well,
or
maybe
do you
not.
mean plan one's
You plan.
day?
You plan. So if you've got 5 minutes left of the session, you don't say things that are going to release a huge amount of emotion. But if you've got 15 or 20 minutes left in the session, then you can.
It's one of the things I tend to use sometimes when I'm taking the case history, my initial feeling is this is stress related, but I won't necessarily say at that point, are you under a lot of stress?
Why not?
Yet. At that point, I feel like I want to finish the case history, do my examinations, get the patient on the table, and then ask such a question. And the reason is twofold. Number one, I think when the patient is in that state, it's easier for them to talk about it. And number two, it's too early on in their relationship with me. They haven't yet got my trust.
Okay, so that's a judgment. That's a judgment you make, and that's fair enough. That's your judgment. You find it works best for you.
Right.
Yeah. But what would happen, for instance, how would you react if a patient came in and was at the point of crying?
That does happen.
So would you still say, no, don't cry, I haven't finished asking you all the questions?
No, I don't think I would. I think in that sort of situation, I'd probably hand them a pack of tissues.
Yes.
Give them some time to cry.
Right.
And see where things go.
Very good. Very good.